The next presenter on the list on your program is Dr. Lynne Noon. And Dr. Noon has a local low vision practice. It's called, has the status of a diplomate in low vision rehabilitation. And she's been dedicated her career to this. She's incredibly knowledgeable. Many of you know her from her viewfinder practice. And we hope you'll learn a lot more. Thank you, Dr. Noon.
I want to thank the Macular Vision Research Foundation and Optelec for putting on this presentation, and thank you all for coming today. Today I'm going to talk about low vision rehabilitation and what we do in this type of practice. It's a little different than what your general optometrist or ophthalmologist does, or your retinal specialist. Okay. First of all, what is low vision? Low vision is a chronic, uncorrectable visual impairment that limits daily functioning. Your vision cannot be corrected with medication, surgery, contact lenses, or, quote, regular glasses. And when this happens, people need to see someone who does low vision rehabilitation. And I don't mean some person that's just selling magnifiers. You really want to see a doctor who specializes in low vision rehabilitation so that doctor can prescribe what you need to accomplish your goals. Most general ophthalmologists and optometrists do not provide low vision services simply because it takes a long time. We spend a long time with patients. They don't have the tools that a low vision provider has, so you're usually not going to get low vision services in most general practices. You want to see a doctor who specializes in low vision. And also, the low vision exam is different from a medical or ocular health assessment in that it's a functional exam. What I'm trying to do with my patients is, of course I'm concerned about their pathology, but I'm not treating their pathology. They have other doctors worrying about that. What I'm doing is helping them to function in their day-to-day life and do what they want to do despite having a visual impairment. I can't take away the fact that you have an eye disease that makes your vision blurry, but my job is to help you to accomplish what you need to do during your day so that you remain independent and do the things you like to do. Once you're diagnosed with a visual impairment, it's very difficult to get on with your life and do the things that you want to do if you don't know the tools. You don't have the tools available to help you perform your daily tasks, and you don't know the tricks that are involved in being visually impaired. There's a lot of things that aren't intuitive that we don't do or think of when we're visually impaired. And my job is to make sure you know all of this and know what services are out there. You can, decreased vision does not need to lead to a loss of independence, and never assume that you can't perform a task just because you have a vision loss. Often simple changes that you make in the house with enhancing contrast or adding lighting or using large print products, and then also knowing what services are out there for you can make you be independent. I have a person who works for me in our Sun City office, and she has macular degeneration. She's probably maybe 40, and she's had macular degeneration for years, and she drives to the office using telescopes. We set up a computer workstation with a 32-inch computer monitor. She uses telescopes when she has to see very tiny print, and she gets the day and helps support her family by working. But she has the right tools. There are a lot of people that are young that are visually impaired, and they still have to go to work and support their families. So my job is to get them there, go to work, or just be independent if you're retired. You want to start low vision services when your vision is relatively good. Unfortunately, a lot of my patients are referred to me when their vision is 2200, 2400, or when their vision takes a big turn for the worse. It's nice to have a patient, they start off when they're just starting being visually impaired, because it's easier to take little baby steps using low vision aids than one big step when you come in and you've had a major loss. So I like to see patients around when their vision is around 20/60. And then if their vision changes, we just make little baby steps to stronger or different low vision aids. You also don't want to wait until your vision is stable. In the past, a lot of doctors say, oh, unless you've just had surgery and you need to go through post-op for a little bit. But if you're getting injections, they may go on for 5 years. You know, what is stable anymore? There are plenty of inexpensive solutions out there to get you by until you are stable, okay? So don't wait until you're, quote, stable, because you still have to pay your bills, take care of your house, do things, even though your vision is blurred. And again, there's plenty of inexpensive things to help you get by. Common myths: losing vision is just part of getting older. And that's not true. Some normal changes in vision occur as we get older. However, these changes don't lead to low vision. Low vision or visual impairment results from eye diseases such as macular degeneration, glaucoma, diabetic retinopathy. And I would say 90 to 95% of my practice is macular degeneration, because that's the leading cause of visual impairment in this country. One myth: you can damage your vision by using your eyes. You cannot damage your vision by using your eyes. You know, I'll have patients say, I don't read anymore because I don't want to make my eyes worse. You know, conversely, you may not make your eyes better by using them, but you learn how to get around your blind spots and use your eyes better if you use them. So don't think you're harming your eyes by using them, okay? Again, myth: you can preserve your vision by not using your eyes. And you do whatever you want to do to get through the day. And if you're tired, take a break. But continue on. Myth: reading glasses cannot be made for my eyes. If you can read with a magnifier, you can read with glasses. You know, what difference does it make if I put a handle on it and call it a magnifier, or I put it in a frame and call it a pair of glasses? Although glasses are going to be prescribed more for your eye. So a lot of times doctors will say to their patients, general optometrists or ophthalmologists, we can't go any stronger. And generally that means we can't go any stronger in regular glasses. That doesn't mean low vision glasses can't be made stronger. The standard bifocal power that most doctors prescribe is about a plus 250 to a plus 350. We can go up to 80. So don't think that we can't make glasses. Now, there's advantages and disadvantages to why you'd use different low vision aids. But if you can read with a magnifier, glasses can be made for you, okay? But you're going to have someone who does low vision rehab to prescribe these. Legal blindness. A legally blind individual means a person whose central visual acuity cannot see better than 2200 in the better eye with best correction, meaning they can't see better than 2200 when wearing their best glasses or contact lenses, or that the widest diameter of the visual field subtends an angle no greater than 20 degrees, meaning they can't see out to the side. Don't let the term legal blindness scare you. People come in and say, my doctor declared me legally blind, like there's absolutely no hope for them. And people equate that with being blind. Legal blindness is nothing more than a legal term. It is not a functional term. At some point, the government decided when your vision is such and such, you're entitled to some services through the VA or through the state services. It doesn't mean that you can't see or that you're blind. There are people out there that are, quote, legally blind driving cars, legally and safely. So don't get worried about that term. It is not a functional term, okay? 20/20 vision, that's usually the goal of any eye doctor who's doing refraction for glasses, to get the patient to 20/20. You don't really need 20/20 in the real world. If you go to McDonald's and you want to see the menu on the wall, you might need 20/80 vision. Microwave controls, you might need 2100. When you want to read a newspaper, if you hold a regular newspaper at 16 inches, you need 20/50 vision to see it. So you don't have to have 20/20 vision. Grooming, maybe 20/50 to 2100, but most people, their independence is threatened when they get to 20/60 because it's getting harder to read. It's getting hard to see your mail, pay your bills, do things around the house. And those patients are going to need special lighting, enhanced contrast, and low vision aids or glasses to help them do their daily tasks. All right, tip number 1, make what you want to see larger. And there are 3 ways to magnify. My job, basically, if you put it real simply, is to make things big enough so you can see it, okay? There's 3 ways to do this. One is relative distance magnification. This is really easy and it's free. The object is brought closer to the eye. An example of this, well, this isn't free, but reading glasses, The reason reading glasses work like this is the stronger they are, the closer you have to bring your reading material. You're not getting magnification from the glasses, you're getting magnification by bringing things closer. A good example of relative distance magnification is move closer to your TV set. That's not going to harm your eyes, and you're going to see it a lot clearer. Here's a TV set viewed at 14 feet. Here's the same one viewed at 3 feet. Just look at the difference. If you have to move your chair up to the TV set, move your chair up to the TV set. You know, your visual impairment's not going to go away, and you need to accommodate what's going on in your life, and if it means sitting up to the TV set, do so. Relative size magnification, we just make the object bigger. Examples of that of large print books, large print checks. By the way, every bank has large print checks if you ask for them. They also have lines that are tactile so you can feel them. Get a larger TV. Write larger. I couldn't tell you how many patients of mine say, I can't see my writing anymore. And it's like, well, write bigger, you know, but you don't think of that. You continue to do the things the same way. We have felt tip markers, and they actually have some. Optilec was kind enough to bring some. These are 20/20 pens, and they don't bleed through, but they make a nice heavy line when you're writing. Don't use skinny pens, blue, red, whatever. You want a black, like felt marker or a gel pen. Use heavy lined paper so you can see what you're writing, and write bigger, okay? When you put your medications out, put the bottle, label the bottles with a big white tag with the print. When you go to the grocery store, label all the cans and things so you're not always saying, what's in my closet? You have it already labeled for you. You make yourself a lot easier. You can buy these little labels. They're mailing labels or stick-on labels at any Office Max or Staples. Here's some other relative size type products. Watches. We have large print watches, talking watches, large print timers, clocks, bingo cards, games. There's a good selection back in the back there. Even measuring cups with larger markings. But we also like to use these measuring cups because we have them in black and white. So if you're, say, measuring flour, measure it in a black measuring cup. That's going to give you more contrast. If you have something that's dark, use a white measuring cup. Large print TV remote control, we have 3 different styles of those. Large print phones, we even have large print cell phones. Large print and talking calculators. So there's a whole host of low vision products out there that are in large print. That can just make your life so much easier. For a computer, you can be totally blind and use a computer. And we put a lot of people back to work with various stages of visual impairment using a computer all day. But the thing is, we modify their computers. We can use, you're going to use a larger monitor. Both Windows and Apple operating systems have settings for people with decreased vision. And I have people that bring in their computers into my office, and I'll sit there and help them, we'll set it. And if it's something past my knowledge, we have people that'll go in your house and work with you with that. Use a Kindle, a Nook, or an iPad. If you want to read novels, there's no better way. You can make a black background with white letters and make them bigger so you can see them. But with a computer, you can always use a computer. Don't give that up. Well, we have large print keyboards, and we have them in 3 different colors. Now, the next type of making things bigger is angular magnification. And this is, the object is not changed in position or size, but an optical system is placed between the object and the eye, making the object appear larger. And what this is a hand magnifier, a telescope for seeing at distance, or a video magnifier for reading, and there's some video magnifiers back there also. Here's an example of what I do for a living. It's in its simplest form. There's 12-point print at the top, like a newspaper print. I put little holes in the print to simulate macular degeneration. I carried those holes down the text. But what I did was I kept making the text bigger and bigger. So basically, if I can make things bigger than the hole in your vision, you're going to be able to see them. Okay? So we have to find out what is going to work for you, what power do you need, and then we're going to decide what kind of tool would work the best for you for the task that you have. The stronger the magnifier, the smaller the lens. So everybody comes in and says, do you have that big page magnifier? You know, sure we do. It's a terrible magnifier. It has a lot of distortion in it. But people come in and they want to see it. Once we show them that it's not a good magnifier, of course we turn them to something better. But the stronger the magnifier, the smaller the lens. If you need a real strong magnifier to read, a big lens magnifier is not going to work. And the reason for that is the stronger the lens, the more distortion there is in the periphery, and they have to keep making the magnifier smaller. Okay, so as much as you wish you could have a big magnifier, it's probably not going to happen for someone who's got a significant visual impairment. You always want to have a magnifier with a light in it, a nice bright light, because people with macular degeneration need lighting. These are stand magnifiers, and again, the weaker the magnifier, the bigger the lens, and then as it gets stronger, the lenses get smaller. A stand magnifier sits on the page so your hand doesn't get tired when you're using it. And what I do during the exam is I'll find out what power you need to perform whatever task you want. Then I'm going to tell you, this is what you need. You just don't come in and pick out a magnifier and think it's going to work. I prescribe that for you and tell you what's going to work for you, and then you need to be trained to use it. For distance, we use telescopes, and they're basically mini binoculars. We can spectacle mount them and put them on glasses. They can be clipped on your glasses. You can hold them in your hand or put them on a neck cord or a finger ring. And we use them a lot, especially with kids. We put them on a little finger ring, and they can see the blackboard in school. You can also, if we spectacle mount them, you can use them for seeing the computer, music, TV, because it's going to give you magnification at a greater working distance. If you go to the Phoenix Symphony, there's a patient of mine that uses telescopes to read her music, but she needed something that's going to give her magnification a little bit further out, and we fit her with a telescope. When a person's reading with a telescope, you're going to get a greater working distance than you would with regular glasses. And these are very similar to what surgeons use to do surgery, or your dentists, because they want to have a little working distance and magnification. We also have pre-made glasses. They're very popular. These people use these for watching television. They're inexpensive, pre-made. You just focus them and watch TV with them. You can't walk with this type on, but you can certainly sit and watch a play or your television. We also fit people with telescopes for driving. It is legal in, I think, 46 states to drive with telescopes. And in Arizona, you can have vision up to 2200 and use no more than a 4 times telescope, but you must pass the same vision standards as a person who is normally sighted. So what we do is if a person passes the vision standards with a telescope, we evaluate them to make sure they have the cognition and the reaction time to drive safely. Then we also train them to use the telescopes, and we have someone who will train them behind the wheel of a car. We don't just fit you with a telescope and say, see you later. That's not what we're going to do. And not everybody is going to be fit with a telescope for driving, okay? Here's how a person uses it for driving. They see normally through the carrier lens or the regular lens of the glasses, and then when they want to see traffic conditions or anything up ahead, they just dip their head and look through the telescope. You're going to get a much smaller field of view looking through the telescope, so you're only going to look through it for a moment or two at a time. And we don't let you go and drive until we know you can spot a sign or what's going on very quickly, okay? Other ways of magnifying, and Dr. Seathram went through this, and I just put a couple of slides here, but the implantable telescope is out there now. It's not for everybody. You have to be 75 years or older. The telescope is 2.7 times, and you can't have had cataract surgery in the eye that's going to use a telescope, because they're going to do the cataract surgery at the time they're going to put the telescope in the eye. There's trade-offs to this. The person using the telescope is going to use one eye for navigation or for the peripheral vision, and then the eye with the telescope is going to give them the central vision. You can't use your 2 eyes together anymore because they see different images. So we have to also train you to be able to navigate safely and use the telescope. And that's something we evaluate before you even have the surgery, but that is available out there. Another type of magnification is video magnifiers. For anybody with a significant visual impairment, these things are just phenomenal. I can go up to 20 times in glasses. We can go up to 84 times with magnification with a video magnifier. And when you consider that a standard pair of glasses is about 3 diopters, and low vision glasses is 80 diopters, the equivalent to 84 times is about 320 diopters. That's a lot of power. But also, you can reverse the image so the background is black, letters are white to cut glare. You can make things as big as you need. And you can put anything under there and convert it into a large print. So if you want to cut your fingernails or do nail polish, do crafts, these tools are wonderful. And we have them as desktop models and portable models. And we also have that you can hook your computer into and use the two together. Here's some portable models of video magnifiers that you can take with you to the grocery store, wherever you need to go, the restaurant where you can't see what you're doing, reading a menu. Okay, tip number 2, increase task illumination. People who have retinal disease or optic nerve disease need a lot of light to see. An elderly person requires nearly 3 times as much light as a 20-year-old, and that's without pathology. So say now you're going to add some pathology to this, you need a lot more lighting. So you want to use daylight type bulbs, whether they're fluorescent or incandescent. The GE Reveal bulb's a good bulb. And you want to have gooseneck lamps that put light on what you're doing and not cause glare in your face, because conversely, you need a lot of light to see, but you're very glare sensitive. Here's how you're going to use a lamp. The lamp here is coming over the person's shoulder. You want the light within a foot of your reading material. Having a light on the table next to your easy chair is probably not a good light. You want a gooseneck lamp that comes right over your shoulder. Okay, here's some other lighting we have. We have some portable lighting that you can take to restaurants to put over your food so that you can see your food when you're in a restaurant. Portable lights that can clip to your screwdriver. There's plenty of lights out there, and I really make it my job to try to find good usable lighting for my patient. We have one that's a flashlight, and then you flip up the base, it turns into a little lamp that can sit there and work for you. And so if you use good lighting, that's going to enhance contrast in your life. Make you see things better. Put lighting under your cabinets in your kitchen. Illuminate stairways or where the frame of the bathroom, so if you get up in the middle of the night, you know where that is. Because it's very easy to lose your balance if you just don't have the right perception of where things are. So use lighting to light hallways so you know where you're going. Tip number 3, you decrease glare. People are very glare sensitive when they have a vision problem. Glare can further reduce your vision and cause eye fatigue. You want to decrease glare from lighting, windows, and the sun. You want to use tints. I like the amber tints on a lot of my patients, and I'll send them outside to try different tints, and we find a tint that works for them. You don't just want to keep getting darker and darker tints to cut the glare, because what happens is now you can't see the curb of the step. So we want to make sure we have a tint that cuts glare, but you can still see, and then we put it in a frame that has side shields and hugs the face so you don't get glare coming in from the sides. And these are some types of frames. We can do them with a prescription or without that hug your face really good. Number 4, enhance the contrast between what you want to see and its surroundings. People with a visual impairment can see better if objects are black and white, and you've probably already figured that out. So when you're pouring coffee, pour it into a white mug. Don't pour it into a dark mug. When you put your plate down on a placemat, make sure there's contrast so you can see the edge of your plate. Mark your appliances. Very simple to do. Now you can line up 2 colored dots and know what cycle you're on. Change the plates on your electrical outlets. You're going to be able to see them better, okay? So just think, how can I get lighting on what I'm doing? How can I get rid of glare? How can I enhance contrast? And how do I make things bigger, okay? And we'll help you with that during the exam. Another way to enhance contrast with the yellow is the yellow filters again. Don't use heavily decorated plates, because it's very difficult to see what's the flower on your plate decoration versus your food. And don't use clear glasses or dishes, because they're invisible. Tip number 5, make sure you're using the correct magnification product and product power for the task. Not all magnifiers are the same. We kind of discussed this before. And using the wrong power is going to result in your failure. People come in my office every day and say, you know, I've used those magnifiers, they don't work. Well, yeah, you had the wrong magnifier, or you didn't know how to use it. So it's just like wearing your friend's glasses. Your magnifier is individual for you and your task. You don't want to go to Walgreens or Walmart and buy your magnifiers, okay? Have your eye doctor prescribe it. Use your products correctly. I couldn't tell you how many people get a magnifier and they say it doesn't work. It's because they're not using it correctly. You know, we do our best to train our patients, but sometimes it's so overwhelming, everything we go over, you may go home and you forget what we said. If you have any problems, you come in and we'll train you again. You need practice and patience. If you haven't read in a year, it's not going to happen in 5 minutes. You need to take some practice and learn to scanning text and read again. And pretty much for every week a person is not read, it's going to take a day of practice to learn to read with some reasonable speed and accuracy. Don't expect it to come overnight. Have patience and work at it. Here's an example. Here I was looking out a window, standing in the middle of the room, and then I went up to the window and I could see the street. This is the same thing when you're using a magnifier. Here's the picture at the bottom on the left-hand side. You're looking at the magnifier from 6 inches versus putting it right up to your eye. Look at the bigger field just by bringing your magnifier to your eye. You're going to see a lot better. So, again, using your magnifier is going to really help with your performance if you're using it correctly. Low vision products are often task-specific. You're going to need more than one low vision aid to accomplish everything you want to do. It's not like in the past where you had one pair of glasses and it did everything. Low vision products and solutions are often very task specific. It's kind of like a carpenter. You're not going to build a house with a hammer. You're going to need a screwdriver, you might need a saw, different things to help you do that. It's the same thing with low vision aids. Reading glasses may help you for reading as long as you use a good light. But they're not going to work good in a dark restaurant. There you may need a magnifier with a light in it. You'll need a gooseneck lamp for reading. You might need a telescope for seeing things at a distance. Sunglasses with side shields to help cut glare. You might even need a lighter tint to cut glare indoors, or if you go to Walmart or Target with all those fluorescent lightings. So you're going to need more than one thing. It doesn't mean you have to do it all at once, but know that one thing probably is not going to accomplish everything. We're getting there, guys. Learn to use your eyes more efficiently. A person with a normal, healthy macular or macula looks straight ahead when they're looking at somebody or anything. And when you move your eye around to see things because you're moving the macula around, because the macula is the only place that sees 20/20. Well, if you don't have a good macula anymore, or you don't have any vision in the center, if you keep looking straight ahead, you're not going to see it. So you have to learn to use your peripheral vision. And when I try to tell patients that, what they do is they move their head, they move their eyes, they move their body, and they have no clue when they find out where oh, now I can see better. Well, where's the spot? Because they move their head, their body, everything. Just look at whatever you want to see, or pick something and pretend it's the center of a clock. Look at 12 o'clock, 9 o'clock, 3 o'clock, whatever. Move your eye around, and at some point you're going to say, oh, I can see it better if I look, say, maybe 6 o'clock to something. Then practice doing that to everything you do. You'll find it better. And I'm sure if you have a vision problem, you've looked at something in your house and you saw something, and then you could never find it again because you didn't know where that spot was that caught that say, penny on the floor or whatever, okay? So practice eccentric viewing. Number 9, substitute ears for eyes. There's a lot of great talking products out there. There's a talking book library that's free of charge. You can get books on cassette or tape. They mail them to you free. You send them back free. There's also talking watches, clocks, calculators, scales, glucometers, computer software. You can even have, if you want to read a book, you can even have the Kindle or the Nook read to you. So there's a lot of ways to do things. Next tip number 10, be your own advocate. Tell your friends you're visually impaired. I couldn't tell you how many people say to me, oh, I don't want people to know I'm visually impaired. Why? You know, you have a vision problem. It's no different than if someone needs a cane to walk. Tell people you're visually impaired. So if they come up to you, they don't just start talking, you don't know who it is, and you're embarrassed. Ask for large print menus in restaurants, or if you live in a retirement community, tell them to have large print menus. Ask for large print activity guides. Get large print checks from your bank. Ask your church to print a large print bulletin. And I've seen churches do that, and they mean well, but then they print like on blue paper. So make sure it's white paper with black letters, and use a font that's like not a fancy font. You want a block font like Arial. You want black text on a white background. Okay. Become familiar with your community resources. You're not alone out there. The support groups, counseling, transportation services. I can't think of the place off the top of my head because it's brand new, and I can tell you in my office, there's a new service out there. All you have to do is call and tell them where you live, and no matter where you are in the country, and they'll tell you the transportation services that are available to you. I know a lot of them in my office, and if you come in, we can give you a list of what I have. But this place, for the life of me, I can't remember right at this moment, but if you come into my office or call us, we can get that for you. Community resources, talking book program, large print books. There's various agencies that serve the blind and visually impaired. DES has an independent living services and vocational rehabilitation programs. You can get free telephone directory services if you're visually impaired. There's also descriptive video services, which describes TV programs or movies for you. It's like closed captioning for the hearing impaired, but it's for the visually impaired. And Harkins Theaters has those also. All you have to do is ask for the earphones for the descriptive video services. And tip number 11, don't become dependent on others. Your family can be very helpful to help you adjust to your vision loss, but don't fall into the trap of becoming dependent. I personally think that's worse than being visually impaired, when you can't do anything for yourself. And if your spouse dies, you're up a creek. And I have seen that happen so many times. That's not the time to start learning how to balance your checkbook and read your mail again. Continue doing things. Don't give up your daily tasks. Learn to use the low vision aids, and your family needs to support your independence. So I tell my patients sometimes, like, back off and let them do it. They'll figure it out, or they need to come to see me, and I'll help them figure it out, okay? And thank you so much for having me here today.